Hello, good morning. So, good morning, students. Today, we will deal with one of the most important international health agency, that is WHO. So, as you know, WHO stands for World Health Organization. As you know, in the introduction class, we have explained how the WHO took birth. Is nothing but the culmination of the efforts by several nations, and ultimately on 7th April its constitution was accepted by all the nations of the world, almost all the nations of the world. So it is shortly called WHO, but not as WHO. Whenever we pronounce it as, it should be pronounced as World Health Organization or WHO. As you know, it is a specialized non-political health agency of the United Nations. Because United Nations has established it on 7th April 1948 with the headquarters at Geneva, Switzerland. So every year since 1950, the 7th April has been celebrated as World Health Day. On World Health Day, World Health Organization comes with a specific public health problem of utmost importance. So on that day, they start the awareness program regarding that aspect, and it should be continued throughout 1 year to make the people aware of the particular theme. But the main objective of the World Health Organization is attainment by all people of the world a level of health that will permit them to lead a socially, economically productive life. Ultimately, what we want a qualitative life. We should not add years to life, but life to years. We should have a qualitative life where the person should not be handicapped or disabled or mentally deranged, and socially active. Should be socially active and economically productive as long as possible to attain the highest level of health. The unique features of WHO are: it has got its own constitution, it has got its own governing body, it has got its own membership and own budget. It is a part of United Nations organization, but not subordinate to United Nations. So membership of the WHO is open for all countries. Most countries are members of both United Nations and WHO, except Switzerland, which is a member of the WHO but not the member of UNO. Presently, it had 194 member states. That means 194 countries are contributing to the WHO membership, and it has got 2 associate membership. Membership states can participate in the World Health Assembly and they can vote. They have got the power of vote, but the associate members, they don't have power of vote. They can participate, but they don't have the right to vote. Now, coming to the functions of the WHO. WHO is the directing and coordinating authority on all international health work. Its main primary work is giving the direction and coordinating on health matters, like identifying the health problems all over the world. Wherever the health problem arises, they will identify, they will confirm, and they will take action. They define the health policies, what should be adopted, and they fix up the targets to cope with the problems. It devises strategies principles and programs to give effect to these policies and targets. So whatever the targets they fix, they monitor and follow whether the targets are fulfilled or not. So otherwise, they will give instructions how to follow. So one of the important functions of the World Health Organization is prevention and control of specific diseases. It may be prevention of all communicable diseases or non-communicable diseases. Communicable diseases, the greatest achievement so far the World Health Organization achieved is the eradication of smallpox. And we are also nearing to the eradication of poliomyelitis. So poliomyelitis, we can see in the near future, the eradication, almost all the countries or nations have eliminated polio except few foci. The epidemiological surveillance of the communicable diseases of international importance under international regulations. WHO also is a surveillance work on communicable diseases of international importance. It releases weekly epidemiological reports with all details, where it has occurred, how it has occurred, who are the persons, what is the case fatality, how it is spreading, what are the routes of transmission, how far it has spread, what is its trends, all these things, they will weekly release reports from each country. World Health Organization has also recently come up with the emergency scheme for epidemics. Whenever necessary, they will come up with the emergency scheme for epidemics. The aim of the international regulation is to provide maximum security against international spread of the diseases with a minimum interference to world traffic and trade. That is the primary objective of international health regulations. So under international health regulations only, all these agencies have come up. And the prevention of non-communicable diseases such as cardiovascular diseases, cancers, genetic disease, diabetes mellitus, mental diseases, etc. WHO also works on not only communicable diseases and non-communicable diseases directly, but they also work on relevant fields to control the communicable diseases and non-communicable diseases, such as the relevant fields are vector control. We control the vectors responsible for particular diseases in the form of direct anti-larval or anti-adult measures or treatment of the insect responsible for it. They can control the vectors. Immunization against the common childhood diseases, that is extended program of immunization, common diseases like diphtheria, tetanus, pertussis, measles, etc. They will take care of all those diseases through immunization so that communicable diseases will be reduced and morbidity and mortality due to childhood diseases will reduce. Quality control of the drugs and biological products. They will control drugs and biological products so that the quality of the and standard of the life will be improved. Drug evaluation and monitoring, regular evaluation of the drugs and monitoring will be done by the WHO. Another aspect is development of the comprehensive health services. Always we should have a comprehensive health services. The health services should not work in isolation. It should be comprehensive, for which WHO promotes and supports national health policy. They give liberty to each nation to form their own policy and development of the national health programs, which encompasses activities like organizing health systems, based on primary health care. Primary health care was evolved after a lot of churning on the health problems in 1978. So, basing on the principles of primary health care, each nation has to develop their own health policy, for which WHO supports. Development of the health manpower and utilization. Health manpower and the infrastructure should be there, and they should be properly utilized. How many hours they work, how many works of qualitative work is there, that should be there. Building long-term national capability. They try to build up the national capability in areas of health infrastructure development and manage their capabilities. They give some training and some guidelines they provide to develop the managerial capabilities. Health services research, how the health services are going on, whether they are going in right direction towards the improvement of the health or not, whether they are declining from the output, what is expected, they will study. That is called health services research. World Health Organization also launched recently appropriate technology for health, a new program to encourage the self-sufficiency in solving health problems as a part of primary health care. Self-sufficiency, each nation has to develop their own infrastructure and their own program within the available resources. That is what appropriate. What is, after all, primary healthcare is what is appropriate, what is accessible, what is affordable to the nation. That must be made available to the people. That is the principle of the primary health care. In those lines, they have launched appropriate technology for health. So family health also, since 1974, WHO has committed to involve in the family health, because family is the unit of any nation, the building unit of any nation. To improve the quality of life of the family health program is subdivided into maternal and child health care. Of course, family consists of different age groups and different aspects like nutrition and reproduction, education. So, they subdivided, and with these fields, they will improve maternal and child health care, women reproduction, nutrition, health education, etc. Next aspect of the World Health Organization function is environmental health. Unless environmental health is maintained, we cannot maintain our own health. Provision of the basic sanitary services like protection of the quality of air, quality of the water, quality of the clothing, quality of the working conditions will be watched. Protection from the radiation, we are exposed to different radiation hazards due to different occupations. So they will suggest the protective measures for that. Early identification of the hazards and the new technology. Whenever the new technology is introduced, that will be very attractive to everybody. Everybody will use the new technology, but the hazards of the new technology should be identified and early action must be taken. So it identifies the hazards. Suppose the cell phones are introduced and we are enjoying all the cell phones for hours together, and we are exposed to microwaves and radiation hazards. Those hazards will be studied and appropriate measures will be preventive measures will be suggested. Development of development of programs to improve the environmental health. There are two programs. One is WHO Environmental Health Criteria Program and WHO Environmental Health Monitoring Program. So, environmental criteria program means the environment. So, certain criteria laid down. For example, in the air, these are the standards. The carbon monoxide, sulfur dioxide, carbon dioxide, suspended particles are in a, they are fixed, should be in the permissible limits. If they cross those limits, the criteria will be taken into consideration and appropriate measures will be taken. That monitoring will be done regularly. Health statistics. For each and everything, we require statistics to compare with the different parts of the country and different countries on the globe and different continents on the globe. So WHO is concerned with the dissemination of the morbidity and mortality statistics related to health problems in the form of weekly epidemiological record, quarterly World Health Statistics, annual World Health Statistics, in order to enable us to study the trends of the particular health event or health hazard. We have the weekly epidemiological every week they will give the report. And quarterly once they give the statistics, annually also they release the statistics in order to compare. World Health Organization also publishes international classification of diseases. A list of diseases will be classified. Otherwise, each country will have its own classification. So WHO regulates the classification of diseases, which a particular number will be given. According to that number and the system, the disease will be arranged and it will be included in that particular system. So such a system, the next classification of disease system will be updated once in 10 years. WHO also assists countries to improve their medical records. So medical record maintenance is still poor in certain developing countries. So that should be improved. World Health Organization assists countries in this regard. The biomedical research. WHO stimulates and coordinates the research work. It has worldwide network of collaboration centers, regional advisory committees on health research. Regional advisory committees for each region, one advisory committee. There are 6 regions of the World Health Organization. From each region, one advisory committee will be there regarding for advising on health research. It also targets 6 tropical diseases, neglected tropical diseases for research and training. So the tropical diseases, right, they are very once upon a time they are very seriously considered. Now they are being neglected. So WHO doesn't want they should be neglected because they may research and cause a havoc. So malaria, filaria, leprosy, leishmaniasis, trypanosomiasis, and schistosomiasis, they are directly under the supervision of World Health Organization. Each country has to send all particulars regarding these diseases. Malaria, they could not eradicate up till now because of various reasons, but deaths due to malaria is reduced. The morbidity also reduced. Better treatment modalities have come. Leprosy is also coming to visible points, and filaria is also reduced. So likewise, all these diseases are targeted in order to eradicate those diseases, or at least the deaths should be very minimal. The cases should be also minimal. Health literature information. WHO is also very much concerned with the health literature should be available to all. The information, public information system is also there to give information for the people who want it, either professionals or lay people. So the METLAS is one which is called Medical Literature Analysis and Retrieval System. METLAS is a system to which we can retrieve the information of US National Library of Medicine. United States National Library of Medicine is one of the satellite centers of the WHO. It is nothing but the index of all medical knowledge. This can be retrieved according to our needs. WHO has got public information service at headquarters and each regional center, each regional office. There are 6 regional offices. These six regional offices each will be having one public information service where the public will get all the information regarding any disease or health events or epidemics like that. The cooperation with other agencies, WHO always works in cooperation with United Nations and other international organizations like UNICEF, United Nations, UNDP, and CARE, like that. Briefly, the functions of the WHO can be remembered in an alphabetical way. A stands for prevention and control of all communicable diseases and non-communicable diseases. B stands for biomedical research. C stands for cooperation with other organizations like UNO and non. D stands for development of comprehensive health services. E for environmental health. F for family health. G for general information and health literature. H for health statistics. So A, B, C, D, E, F, G, H, you can remember, and the functions of the WHO can be comprehensively remembered. Now, the structure how World Health Organization works, what is the base for it? World Health Organization structure consists of three components: World Health Assembly, Executive Body, and Secretariat. Now, the World Health Assembly, it determines the health policy and programs for all countries, reviews the work of the past year. It meets once a year, usually in the month of May, and approves the budget and approves the budget for the next year and elects the members of the states, and it also elects Director General of the WHO. Usually meets once in a year at headquarters of the WHO, that is Geneva, Switzerland. Occasionally they meet in some of the regional offices. The executive board of WHO consists of 34 technical experts in the field of health to give effect to the decisions and policies of the Assembly. The Assembly prepares policies and make decisions. Those will be implemented by the executive board through the members of 34 technical experts. The Secretariat is headed by the Director General of WHO. It provides technical and managerial support to its member states. Director General of the World Health Organization is the supreme authority. He is assisted by 5 assistant director generals. The staff started with the 250 staff in 1948. At the beginning, it started with 250 staff. Now there are 8,000 staff in order to support different divisions of the World Health Organization. Those different divisions will be headed by the assistant director generals. The assistant director generals, they take There are four divisions and they will report to Director General. Thus, Director General will take decisions. So, WHO organization has got different divisions to deal with different aspects of the health because health and health related problems, health related events, its management and all are divided into 14 divisions. So division of communicable diseases, division of non-communicable diseases, division of family health and environmental health, division of mental health, vector biology and control, epidemiological surveillance, and health services division, division of health manpower development, information system division, budget and finance division, and public information and education in health division, division of diagnostics and therapeutics and rehabilitation technology, strengthening of the health services. So there are 14 divisions are there. So 3 or 4 divisions will be taken by each of the assistant Director General of World Health Organization. There are 6 regions. All the nations are divided. The globe should be is divided into 6 regions with the specific headquarters. So one of such region is Southeast Asia region, to which we belong. The headquarters is at New Delhi. Africa region headquarters is at Brazzaville, that is in the country of Congo. America headquarters is at Washington DC, USA. Europe, Copenhagen, Denmark. Eastern Mediterranean region, Alexandria is the headquarter. Egypt. Western Pacific region, Manila is the headquarter, and the Philippines. So these are the 6 regions. 6 regions. Each region we have a regional office or WHO house. We have got at New Delhi World Health House at the Indraprastha area of New Delhi, Indraprastha State, New Delhi, which controls our compliance information and disseminates the information regarding health for 11 countries. Now coming to the Southeast Asia region to which we belong, India is headquarters is in India, that is in New Delhi. So 11 countries in this region are India, Bangladesh, Nepal, Sri Lanka, Bhutan, Myanmar, Korea, Maldives, Mongolia, Indonesia, and Thailand. So World Health Organization, as we said earlier, releases one theme of public health importance each year since 1950. On 7th April, which is the World Health Day. World Health Day is celebrated on that day with the specific theme. Not only it is confined to that particular day throughout the year until the next birthday of the World Health Organization comes, that theme should be followed in different forms, in the form of campaigns, in the form of poster presentations, in the form of debates, in the form of public meetings and all, so that the public will be made aware of the public health situation of the particular event. A sensitive event will be there. So 1915, we started with Know Your Health Services. We must know wherever the services are available. Unless we know, we cannot take proper action. And we cannot access at the time of need. So every citizen of the country must know where the health services are available, what are the health services available, where we have to go, to whom we have to approach, Now, all these things will be made, this information made available to the public. Next, health for your child and voice children. So not only your child, all children, so health aspect, immunization, baby care, growth care, nutrition, all these aspects will be made available. Healthy surroundings make healthy people. Health is wealth. This is of utmost importance. Whatever may be the wealth, wealth itself has no value unless health is there. So health is the wealth. Health is the wealth. So unless health is there, we cannot enjoy the wealth. So health is wealth. Nurse, the pioneer of the health. Again, the importance of the nurse is recognized as early as 1954. Again, this year, due to spread of the COVID pandemic, we have recognized the importance of nurses and midwives. So that's why this year also they have come up with the theme of the nurses. Clean water means better health. So waterborne diseases and all will discuss here. Destroy the disease carrying insects. Food for all. Food must be available to all, not for the few who are healthy. 10 years of health progress, mental illness, mental health in the world of today. So certain themes we will read. Malaria eradication. In 1960, the malaria problem was very much. That's why malaria eradication we have named it, and it's the world challenge. They have come to a challenge of the world. Each individual and states to take responsibility for its eradication. Of course, up till now, we did not eradicate it, but we have controlled a lot of deaths due to malaria, and mortality also is reduced. 1965, smallpox constant alert. Smallpox was very rampant during this period, so they have released the theme smallpox constant alert. Early detection of the cancer saves life. So for cancer, still human beings are suffering a lot, but due to early detection, and certain cancers can be cured. In 1975, smallpox was eradicated. At that time, they have come up with a theme, smallpox point of no return. They do not allow to re-emerge as a problem again. That's why they have come up with the smallpox point of no return. 78, down with high blood pressure. Blood pressure was emerging as a big problem at that time. Still it is continuing at that particular year. They have come up with this theme in order to know how the blood pressure is increasing, what are the risk factors, how to reduce blood pressure, how to keep in control through our change of lifestyles. So, the smoking or health. A lot of people are addicted or habituated smoking. Everywhere it is known that smoking is injurious. In spite of that, youth are inclined to this habit of smoking. That's why they have come with smoking or health. You want smoking or health? The choice is yours. Smoking has got many hazards, and it will definitely lead to lung cancer and even other cancers and lung diseases, whatnot. It leads to some, but luckily it is reversible once it is stopped. That's why they have come with this model. Health for all. By the year 2023, this big milestone. This year 1981 is a milestone. 1978 of the Alma at the Since they have decided health for all by 2020 is a big target that by 2080 uh, everybody must attain the highest level of possible health. But up till now, this could not be achieved. Health for all doesn't mean that everybody will be healthy. Health for all means health should be maximum attainable health should be affordable, attainable, and within the access of everybody. That is the motto. Not everybody will be healthy because it depends upon the individual effort, community effort, national effort, and international effort. So all these things are there. That's why it still remains as a goal forever. Add life to years, not years to life. Add life to years means the years what are coming as bonus of the certain average 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 life years. That is, that should be qualitative years. It should be socially and economically productive life. It should not depend upon, but particular person should not depend upon others. Health for all by year 22 may be countdown. It's 83, there's counted, started counting down up to 2000, but even at 2080, many things could not be achieved. So 88, health for all again, all for health. Health for all for health. So health should be for everybody and everybody should try for their health. Let us talk health. Our planet, our health, think global and act local. Should disaster strike, be prepared. For there are so many disasters we are facing in the form of earthquake, floods, epidemics and all, and we should remain prepared. Since 1991, all the organizations have formulated their own strategy to, to be ready for any eventuality which can come at any time. Whether it be accidents or gas leak or floods or earthquakes like that, we should remain prepared. So many manuals and strategies are prepared that act in the economy, not with a regime of health. World without polio by 2000, they accepted that polio should be eradicated by 2000. It could not be possible. Global strategy was remained as a goal and which can be achieved within a few years. Within few years. And safe blood starts with the blood saves life. Here, the 2001 Health Organization came to the importance of the blood and the importance of sharing our blood with others should be safe and we should start with us. We should start with the blood donation should start with us. So safe blood starts with me. Blood saves life. Life saves life. It should start with me. And 2004 they have commented there. Road safety is no accidents. No accidents means road. If you follow the road safety measures, there won't be any accidents. You should control the speed. You should have the better infrastructure of the roads, speed control mechanism, traffic control mechanism. Various things should be properly adopted. Visibility and all should also be maintained in order to reduce the accidents. Those things were taught and paid to the public. So, World Health Organization come up in 2009, save lives, make hospitals safe in emergencies. We are going to the hospital for treatment, for prevention, cure of the diseases. Instead, we are sometimes we are exposed to certain accidents, certain hypergenic diseases, certain nosocomial infections. So our hospitals must be very safe. It should be neat and clean, hygienic, and nowhere there should be chances to falls and sustain injuries. And it should not be any shortcut of the it's not circuit accidents in the hospitals because we have seen several such incidents in the country of hospitals on the fire and people are scared and they have died and jumped out of the hospital. Such incidents we have seen. So save lives, make hospitals safe in the emergencies. So everything should be available in the hospital to deal with the emergencies. Good health connects life to years, aging and health. The importance of the year before health is felt in 2012. They have come up with this theme, good health connects life to years. 2013, high blood pressure, hypertension. High blood pressure means hypertension, importance of hypertension and its consequences, dangers, and the benefits of maintaining optimal blood pressure. All these things were taught to the So 2014 rapid one years, food safety, diabetes, depression, let's stop depression 2017, 18 and 19 they are with universal health coverage, everyone everywhere. Universal health coverage health should be uniformly there should not be any maldistribution of the health services. Health services should be available with the grassroots level each and everybody. That person universal health coverage 18 and 19. In 2020, as you know, the epidemic of the coronavirus, it's time to be pandemic. And the month of December 2019 itself, December 19 itself, that's why in April, World Health Organization has come up with the theme when they have felt the importance of the services of nurses and midwives and medical people, medical people. So they have come up with the theme support nurses and midwives. So these recognize the services of the frontline workers, frontline warriors in this COVID-19 pandemic. So they have come up with this theme. So this is the logo of the World Health Organization. It is nothing but the United Nations logo. The United Nations logo superimposed by the Asclepius staff with the submounted snake. Asclepius is the god of healing in the Greek time. So this is the symbol of Asclepius on the staff, stick and snake. So we used to have snakes and used to treat the patients. So a lot of persons were healed. So ultimately, Asclepius was blamed by the Greek god and Greek god, and he killed him with a thunderbolt because the human beings become immortal. So the human cycle cannot be maintained. So with that intention, they has killed Asclepius. So thank you very much. This is hearing. Next time we will deal with another important the National Health Agency. Thank Thank you very much.